Well, I was met with my optometrist, and he suspects that I have a cataract in my eye, both of my eyes actually. So I thought, well, I better go see an ophthalmologist. And I had heard about Dr. John Goosey because other doctors send their families to him, and they see Dr. Goosey. I knew of his reputation and being someone who's one of the best surgeons around, so I figured I'd better go see him and see what he thinks. Well, I'm here at the doctor's office waiting for the exam, and you just think about things, and I'm reading information about cataract surgery and the different technologies they use to remove the cataract lens and put in a replacement lens. And it just makes you wonder a little bit. You know, having a surgery on your eye is always something you think about. But we'll see how it goes, and I'll be reporting back to you as my case gets concluded. After seeing Dr. Goosey, I learned that I do have cataracts in my eyes, and kind of felt like that was a little bit of a surprise at my age. He explained that the cataract surgery has changed a lot over the years, and the technology today is just very superior to anything that's ever happened. In particular, he talked about different kinds of lenses that you can have put in your eye to replace the cataract lens that would actually provide a ability to have vision correction at both distance, near, and intermediate. He called it a multifocal lens. So we decided that we would have set a date and have the cataract surgery done. So I started looking into it and learned that the Tecnis multifocal was a new lens that had really provided patients the complete solution of their vision correction. So I talked with him about that, and he had been implanting that lens, and we talked about some other lenses that were available, but the patient outcomes with this lens was pretty good. So I said, that's the one for me, and so we set up the date, and I'm going to have the Tecnis multifocal lens put in my eye. I also learned that there's some other technologies that he's using. As a matter of fact, I learned that of all the doctors in the Houston area, he was only one of two at the time of my surgery that offered this combination of technologies. Not only the multifocal lens, the Tecnis multifocal lens, but a new technology that actually checks the eye during surgery to make sure that the lens that's being implanted is the exact correct lens as far as the power to correct the vision. This is rather new and pretty interesting. Prior to this technology, doctors would estimate what that would be, and most of the time I suppose that was pretty accurate. But with this technology, it makes certain that the lens that's being implanted is the correct lens. It's, I believe, called the Aura system. I also learned that another technology that Dr. Goosey uses is called the Catalyst system, which is actually the most advanced way to remove the cataract lens, the diseased lens in my eye. This particular technology uses a laser to break up the lens and makes it much easier to remove that lens from the eye, decreasing the trauma and the side effects or the post-op problems that sometimes are associated with any kind of surgery. So I said, great, sounds like I've got the best doctor with the best technologies, so I'm ready to go. Well, today's the big day. I'm going to be here for my cataract surgery with Dr. Goosey, and you know, it's always something you think about before any surgery, I guess. You know, you might have a little worry or a little anxiety about it, but I know I'm in good hands with him, and I'm excited about the fact that he has really the latest in technology that I'm going to be using. So here I am, and we'll see how the surgery goes. And well, I've completed my surgery now, and headed home. I'm really kind of surprised. I have really no pain at all, nothing. We had the procedure. I could have some sensation during the procedure, but really it was much easier than I anticipated it would be. And it was amazing because when they removed the lens with that Catalyst technology, it was really done very quickly, didn't take long at all. And then we went into the OR where they actually removed the remaining particles of that lens and implanted the new lens, and that didn't take long either. Well, right after surgery, you know, the moment of opening your eye after the lens has been put in is always something you anticipate. And when I opened my eye, it was amazing. There was some cloudiness. Obviously, I just had surgery, but I was seeing very well. I was able to actually read my watch right after surgery, which I've never been able to do without the assistance of my glasses. I could look across the room and read some things on the wall, which I found to be interesting as well. I had never had that experience. And that was just immediately after the surgery. Well, the day after surgery, I was really surprised. My vision was excellent, and I just decided to go to work. I really had no side effects or problems. So I've decided to get up and head out to work, and we'll see how the day goes. I've noticed for the last several days that my vision just continues to get better and better. Not that it was really that bad even right after surgery. It's actually been very, very good. I'm just impressed with this Tecnis multifocal lens, how well I can see both distance, near, and intermediate. Working at a computer, I find it to be very acceptable and better than I've ever had since I was wearing glasses since I was a teenager. My vision is better than I can ever remember, so that's been exciting for me. Well, things just continue to get better for me. My vision is as good as it's ever been, and I'm here to see Dr. Goosey. At my last appointment, there's very little redness in my eye and no problems at all. So, you know, I feel now that everything I'd thought about or had heard or read about Dr. Goosey and the technologies he's using are really pretty outstanding, and I'm very glad that this was my choice.